Thanks for hearing us. Well, we figured some things out. So just as a reminder, are unable to join us will be able to view this at their leisure when they can a little bit later, and we'll also be sending it around afterwards. I want to just welcome you again. My name is Alex Tapia. I'm a member of the Government Affairs team here at AM LLC. We are a public health firm that has been doing COVID response for the last 2 years, but we've been around for over a decade working in the federal health IT space and doing work at the federal, state, and local levels. We are very pleased to be working with Randy Hayden and his colleague Marisa Bond from Louisiana. They've been incredible partners for us as we've worked with the state of Louisiana. And I will hand it over to Randy in just a moment, but just a couple of quick housekeeping pointers and rules. This is supposed to be an open dialogue. Please, if you have questions, feel free to ask them throughout the presentation. We have some great presenters here, and you're also welcome to drop questions into the chat box at any time. I will also ask anybody who is not presenting to just turn off your cameras so we can keep our screen clear and be able to see the slides. That'll just be really helpful. And again, I invite you to interact with the presenters. And as I mentioned, the call will be recorded and sent out afterwards. So we hope you enjoy this presentation. And Randy, if you don't mind, you can take it away.
Alice, thank you so much. We are honored to be working with the AM LLC. If you'd like some more information, by the way, you can go to their website. It's amllc.co, not com. So amllc.co, and you can get a lot of background information, probably more than I could give you. Many of you probably participated in the superintendent's convention recently in Baton Rouge, and we saw quite a few of the superintendents at that time, and were able to speak, and many of them said, we'd sure like for you guys to do a webinar, and those that could not participate would be able to take advantage of the background that you can offer. And so we appreciate everybody taking advantage of this opportunity. Did want to remind you that it is being recorded so that we're going to send it out afterwards to everybody. And if you have follow-up questions, you can certainly follow up at that time. Please feel free to get in touch with me or Marisa. We will be sending you that contact information. We're here in Baton Rouge and can work with you as far as setting up separate meetings if you would like, or just answering any of your questions. I am honored again to be working with this team, but also equally honored to be introducing our lead speaker this morning. Rear Admiral Louis Tripoli had a 4-decade career in the medical field with the military. The coronavirus pandemic elevated his medical department to the primary military force protection in the theater that he was in, the U.S. Indo-Pacific Command. Since then, as a civilian, he has served medically in cities like Buffalo and St. Louis. He was the chief medical officer for a company that provided health care for inmates, including treatment guidelines at Johns Hopkins University School of Medicine. When he retired from the military in 2020, Dr. Tripoli founded his own veteran-owned consulting company. It's called 3E Care Solutions, and he continues his work on global health issues, veterans' health issues, and the coronavirus. He has taken on the role of medical expert advisor to the American Hotel and Lodging Association. He's a recognized expert on COVID-19 risk mitigation, and he serves as an advisor for the Premier Medical Group. I would like to also just in background let everybody know, we think we see light at the end of the tunnel, and we've seen that same light 2 or 3 times already here in Louisiana, where the ebb and flow of of testing and the ebb and flow of those that have unfortunately gotten COVID continues to rise and wane as was expected. And Dr. Tripoli and others will tell you what we can expect from the future. But I did want to remind particularly everybody here that as Louisiana looks next school year for the possibility of vaccinating 5-year-olds and above, that provides new challenges for the school systems, and we certainly would like to be partners with you to help you make sure that those needs are met. So I'd like to turn it over to Dr. Tripoli, and again, if you've got any questions, you can ask them in the chat or let us know, and we'll be sure to get to you. Dr. Tripoli, take it over.
Thank you so much for that generous introduction. And you know, there's a lot of information here, and in the past, I've found that people are sometimes a bit daunted by all of this information. I'm going to try to make it as practical as I can, but just remember there are no dumb questions, you know, and we certainly have learned a lot, we experts, and there's still much more to learn. Can you see the slides all right, Mr. Hayden? Oh.
Yep, looks great.
Great, thank you. This is a nice quote from one of the Tennessee school superintendent organizations that I'll let you read at your leisure. And again, I believe that these slides will be made available to you if you need them. I also have the references for all of them in case you need any of those. There's a little bit more here about AMLLC. I am a advisor to AMLLC, and I've had the pleasure of working with their tremendous group of professionals, and I can say categorically that they're among the best that I've ever worked with. You've heard a little bit about my background. My christening in COVID came with outbreaks on ships, planes, and troop formations. The U.S. Indo-Pacific Command is the command that covers half of the world's surface. It's headquartered in Honolulu, Hawaii. We have all the services under the combatant command, not just the Navy, but it's Navy, Air Force, Army, Marines. In addition to, I had a number of U.S. Public Health Service people. We also have other government agencies and allies and partners in the Indo-Pacific Command. Very complex program. One of the things that I do now is that I continue to be on the faculty at the Uniformed Services University, and I teach residents at the Nellis Air Force Base Hospital, where I currently live. I'm also a member, as it points out here, at the University of Pittsburgh Center for Military Medical Research and some others. The information I'm about to give you was collected from authoritative sources. It's not official policy of any organization or entity, and it's my opinions. I give this talk to a variety of audiences. The objective here for you is to educate children and young adults and to make sure that they turn out to be productive members of society. We're trying to avoid serious outcomes in vulnerable people through our risk mitigation. We're trying to plan and allocate resources based on reasonable assumptions, which I'm sure many of you understand continue to evolve. And we have to expect the unexpected, and that's part of what we learn in the military planning process. One of the things that I want to point out just as we start here is that the younger you are, the more likely you are to carry this virus asymptomatically. So understand that around 40% of people have no symptoms. And as you know, there's a huge variation as to who's going to get a serious outcome and to who doesn't even know they have it. And so this is one of the issues that we have to deal with. And the younger the population, the more likely they are to tolerate this illness or this infection and to be completely asymptomatic. And so you just need to keep that in mind. A little bit about what's going on now. As you all know, the Omicron variant came. It's now on the wane. There's a new variant, a cousin of Omicron called BA2 that's arising. And we can talk a little bit about that if needed. But anyway, you see the historical spikes here. This yellow line is the number of patients per 100,000. And this red line is the 7-day moving average of cases. I'm sure most of you are familiar with this. And as you can see, this is, of course, CDC data. And you can see the number of infections being reported is falling substantially. Now, let me just caveat that by saying that I think there's a lot of underreporting. I'm going to talk to you a little bit more about that as we go by. The death rate has also come down, as you can see, and I magnified this graph starting basically in November to now. So you see the spike in deaths usually follows the spike in infections, and the death rate is going back down. Oops. Let me go back here. This is a map from the CDC showing the distribution of the Omicron variant. As you can see here, the BA2 is now at 3.9% in the US. It seems to be much higher in Europe. And there's a lot of questions being asked about what that means, but we'll talk about that a little bit on this slide. There was a pretty good study that came out of Tokyo that did a bunch of experiments on BA2 using hamsters and cell cultures. And essentially what's turning out is that BA2 is more infectious than BA1. And Omicron was much more infectious than Delta. So what you see is a trend towards the virus gaining characteristics that allow it to be more infectious. Where's this coming from? There are a lot of people who are immunocompromised. So the virus can replicate in them longer and develop more mutations. So that's one way in which the virus is able to reproduce. As you know, of course, children under 5 are currently unvaccinated, and there's about 19 million of them in the United States. And certainly the virus can replicate in a reservoir like that. Obviously, as you know, it can still infect people who are vaccinated, but at a much lower rate. In addition to that, there's been many studies that show that there are animal reservoirs now of the SARS-CoV-2 infection. And so it's whether it transmits back and forth between animals and humans hasn't been definitively characterized, but we think that that's obviously how it started. There's some evidence here that shows that BA2 may be more pathogenic, but we haven't seen that yet. So we're in clinical practice. So that's the jury's still out on that. In my own experience, I talk to people and I see patients all the time that say, "Oh, I have the flu." Well, I say, "What symptoms do you have?" Characteristic symptoms of COVID-19. You'll hear them say, they lost their taste and smell, they have a fever, they have a respiratory infection. But they did a rapid antigen test at home and it was negative, so they assumed that they had the flu. That's not the case. The flu is not circulating widely right now in the United States. As you can see, Louisiana is green, which means barely any flu. Of course, there are respiratory viruses out there, but the rapid antigen tests are notoriously inaccurate for the Omicron variant. Does that mean that you shouldn't use them? No, you should definitely use them. It's a matter of how to use them. That's the issue. The way that the rapid antigen tests work is that they detect a piece of the viral protein. The virus has to be at a certain level in order to be able to detect that protein. Whereas the other test, what people call the PCR test, the nucleic acid amplification test, can amplify the smallest portion of RNA and find it. So if someone has typical symptoms of COVID and tests negative using the rapid antigen test, the recommendation is to have a more accurate test. But I think what we're seeing is a lot of underreporting because people have mild cases. People don't want to have a diagnosis of COVID. People are attributing it to other respiratory viruses, which I don't think accurate. A little bit about virulence. The Omicron variant has turned out to be less virulent. There's a lower case severity rate. There are some reasons for that I won't get into right now. I just want to say that it's not guaranteed. You'll hear this a lot. People say, oh, well, the virus will get weaker as time goes by. That's definitely not guaranteed. We're very hopeful that it does, and it ends up like the other 4 coronaviruses that give people colds, but we just don't know that. Let's talk about children for a minute, because this is the audience that you're most interested in. Remember, I'm not a pediatrician. I engage in adult medicine and infectious disease. But one of the things that did happen with the Omicron variant was that there was a high level of pediatric hospitalizations compared to previous variants. That has started to go down. That's the yellow line on the left there. And this again is from the CDC website. But people in the age group of 0 to 17 still are the very lowest number of proportion of hospitalized people in the United States. And if you look at it, it's still the oldest people that are most likely to be hospitalized. But there are many other effects on children. And this is an interesting New York Times article from January 4th, where the author wrote about these things, that children fell far behind in the school year and have not caught up. Many children and teenagers are experiencing mental health issues, suicide, gun violence. And of course, as you know, schools have still had difficulty returning to normal. You know, I hear a lot of people say, oh, it's mild, I might as well just get it. What's the use? Who cares? And, for young, healthy people, the risk is low. And you can, yes, and a lot of people say, well, I could still get it if I get vaccinated. That is true, but the vaccination reduces the odds of getting it significantly. And it also reduces the odds of getting really sick, but I'll come back to that. But why would you not want to get COVID-19 if you could avoid it? There's a growing body of literature that shows that there can be hidden long-term damage from even relatively mild infections from COVID-19. There's a group of people that have passed or long COVID. One study showed that 1/3 of older adults, nearly 1/3, developed new health problems following infection. A big VA study just came out of St. Louis showing even with mild cases of COVID, veterans are getting increased risk of cerebrovascular disorder. There's mental health effects and neurologic effects of COVID. There's some problems with it being able to hurt the placenta. There have been reports of male infertility and erectile dysfunction. And as you all know, multi-system inflammatory syndrome in children is one of the rare but serious risks of getting COVID. The CDC published a report on the risk of getting of people who have had COVID under age 18 were more likely to receive a diagnosis of diabetes. So there are some long-term effects of COVID that I think we still don't understand completely. And you may have noticed in the slide, I predict that we're going to see more bad outcomes in the future with things like neurologic disease, like Parkinson's disease and dementia, and lots of other things. Researchers are currently starting to find that there are 4 factors that may increase the risk of getting long COVID. I won't get into that right now. So in summary, for that particular issue, I would say that it's probably a good idea not to just take it lightly and say, I don't care if I get COVID. And I do see a lot of people saying that, young people particularly. If you're lucky and you're a young person, eventually you'll be an old person. And I think COVID is here to stay. It's going to be, the SARS-CoV-2 virus is going to continue to mutate and continue to be part of our environment for a long time to come, perhaps permanently, much like other viruses have done in the past. So let's walk through the countermeasures, what we can do to mitigate this problem. And I know a lot of you, oh, I just want to say one thing parenthetically. It's interesting to note that in China, they're taking extraordinary measures to keep people from ever getting COVID. And I find that to be very interesting because there's a lot of information they have about this virus that we don't have. This is from a previous author who's talked about the Swiss cheese model of multiple layers of defense against SARS-CoV-2. And they've lined up these things so that essentially there's a layering of countermeasures for COVID. And it starts with, don't get exposed, wear a mask, hand hygiene, avoid touching your face, don't hang around in crowds, testing and tracing to understand who has it and where it is, ventilation and air filtration, messaging, quarantine and isolation, vaccines and pills. I'm going to focus on a few of these. I know a lot of you are probably concerned about masks. There's been a lot of controversy about masks, okay? And the first thing that a lot of people say to me is masks don't work. And masks are political, and the reason that they want you to wear a mask is that it's all politics. Well, okay. Let me just cut through all this and tell you, bottom line, masks work. But masks also don't work. And why is that? Well, it's like driving a car, right? You can drive a car and you can drive it safely, or you can drive a car and you can drive it not safely. And as you know, we all experience driving in a car, almost all of us, and we take risks when we drive in the car, and we depend on other people's behavior when they're driving, not to run into us. Masks are very similar. If everybody wore a mask with high fidelity, then the transmission of COVID would be reduced significantly. That is absolutely true. The problem is people don't do that. And when it comes to school mask mandates, the problem there is that, as you know, you have no control over the behavior of your students after they leave the school. So, they may wear their mask 24/7, with great fidelity while they're in the schoolroom. Well, I guess 24 hours a day isn't the right analogy. For their school day, they may wear the mask appropriately. However, when they are socializing with each other outside of school, you don't have any control over that. There's also an issue about the type of masks. Look, bottom line is this. The CDC has finally come around to a belief that I've held for a long time, and that is that the type of mask matters in defending you from getting COVID. There's all sorts of things on there. The CDC recently updated their guidance on this. The bottom line is the better the masks, the better the characteristics of masks, the more protected you are. Remember, masks with poor performance characteristics are only designed to protect other people. So if I wear a mask that is a paper mask or a cloth mask, it reduces my ability to transmit the virus to you. All right. Now, if you wear a N95 mask, it reduces the probability that you're going to get the virus from me. So there's a defense and an offense, in case you want to look at it that way. I'll skip through some of this, but there's plenty of evidence that masks work. I know this. We had outbreaks on ships. It's clear. I'm going to get to, here's where I want to go with this. All right. You need to follow the guidance of your leadership about masks. I can't tell you what to do because there are various laws, mandates, authorities, and you need to follow the advice of your leadership. And that may vary. It may vary because there may be relatively more infections in one place as opposed to another. But as an individual, as a person, when you think about masks, don't just think about the risk to the student, which is relatively low. Again, relatively low. There are rare cases of problems. But it's also, what you really have to think about is who is in my circle, all right? So let's say that my son, who's 20 years old, he does wear his mask, but let's say he doesn't want to. He's going to be, he's not going to do it. But when he comes home from college, he may infect me, who's an old guy, or he may infect somebody who we know who is immunocompromised or has a chronic medical condition, or he may affect a child with a cardiac problem or immunosuppression. So you really have to understand, and understand the risk, not just to you, but that circle of people that you interact with. And remember, the younger and healthier you are, the more likely you are to have an asymptomatic infection. All right, what about vaccines? Okay, I hear everybody saying vaccines don't work. Well, I've already said this, and I'll say it again. Vaccines do work. It's better to have a booster. They work in that they prevent hospitalization and death. Do they prevent infection? Not very well, but they prevent infection a lot better than being unvaccinated. This is a study in California that was published that talks about the effect of vaccines in the Kaiser Permanente Southern California district against Delta and Omicron. And it's just an example of many studies that say the same thing. 53% reduction in risk of hospitalization, 74% reduction in ICU, 91% reduction in death. People ask me, well, what about natural immunity? Okay, the bottom line is that sure, you get immunity from being infected naturally. Absolutely. And there's a thing now that we call hybrid immunity, which indicates that the combination of vaccination and natural immunity is better as far as your immune system goes than either one alone. So the bottom line is this. I don't think it's advisable to go out and get COVID to develop natural immunity to prevent you from getting COVID. But on the other hand, if you happen to have been infected, a lot of people have, the synergy between the vaccine and the natural immunity is something that is highly protective and will last for a long time. Eric Topol, a colleague of mine, wrote that the CDC ought to recognize natural immunity as a confirmed protection. The only way you can really understand whether someone has natural immunity is by checking antibodies in the blood, and even that is not very accurate. But I think you're going to see that antibody testing is probably going to evolve. Okay, well, we also have medicines now, Paxlovid and Molnupiravir. You can give somebody pills after they get symptomatic COVID, and it will prevent them from getting really sick. And there are 2 pills that do that, but they are prioritized for the people who are most likely to have the bad outcomes. And again, consult your healthcare professional. Of course, we're talking to people who are in the academic environment. There are 2 books that I read, and they both, I read these before COVID, but they each, well, I read Benjamin Franklin like more recently, but Isaacson's Benjamin Franklin and David McCullough's John Adams talk about an episode in which Benjamin Franklin and John Adams shared a hotel room. And in those days, people would sleep in the same bed. And John Adams had a cold, and Benjamin Franklin wanted to open the window, and Adams wanted to close the window because Adams said that colds are caused by the cold. And Franklin said, no, colds are caused by something that you get transmitted from somebody else, and having more fresh air keeps you from getting the cold. And subsequently, Franklin kept the window open and did not catch a cold. So even back then, Benjamin Franklin knew something that a lot of us have come to appreciate, and that is that the risk of infection depends on the air quality. In other words, there are things that we can do if you can't wear masks that can help you to keep people from getting infected. And one of the more reasonable things to do is to have clean air. There been a lot of research that shows that COVID is airborne. It's not only airborne, but it's airborne, but other respiratory viruses are airborne. I knew this for quite a while, but for a long time, we were being fed a doctrine that it was surface contamination and people were getting it from surfaces. There's been a lot of information to show that yes, COVID can maintain its virility on a surface, but there have been really no convincing studies that show that people get it from getting it on their hands. It's important to have clean hands and wash your hands and decontaminate surfaces, but I think we took that a little bit too far and we were ignoring the idea of cleaning the air. Now, there's an association between carbon dioxide concentration and I have this thing that I put on my desk here, and your risk of COVID infection if you have no other countermeasures. There's been a lot of work being done on that. So exhaled carbon dioxide may be a risk proxy for different indoor environments and your ability to transmit COVID. Where am I going with this? The bottom line up front is that I think one of the countermeasures that I recommend is to look into air quality in schoolrooms. Now, one way to do that is open the window, but I know Louisiana has some hot, sticky days in the summer and some cooler days in the winter, and so you may not be able to do that. So there are other things, air purifiers that have been used and are portable. Of course, those cost money, and there are maintenance costs and all those things associated with them. So your decision is your decision, or the decision of your leadership. But where we're having difficulties with masks and people are getting mask fatigue, and let's face it, there is some information to show that some children don't tolerate masks very well, that it inhibits their learning process. I think that air quality, indoor air quality, may be your next best focus, and certainly a reasonable thing to do if you can afford it. There are also antibodies that can be used to treat COVID, and there's a new one that just came out on the market. That's a little bit more in the medical field. Again, just so you know that there are things that you can do after you get COVID to prevent bad outcomes, but vaccination still remains the best way of preventing a bad outcome. There's been a recent study on taking these pills that I talked about earlier to prevent COVID in people who are immunosuppressed, and you may see that starting to occur. So people always ask me, what's going to happen next? Well, Yogi Berra said it's tough to make predictions, especially about the future. So I mentioned that there are other human coronaviruses, which are common cold coronaviruses, that have evolved over time and that continuously evolve, but we didn't really got that interested in them. But they reinfect people every few years because they are able to evade our immunity, but they just give us colds. So people don't really care that much about them, but we've learned a lot. And people say, oh, is this going to become endemic? Is it going to be circulating like these common cold viruses? And the answer to that is probably yes, but it doesn't necessarily mean that they're just going to be mild colds. So my prediction, Omicron will not be the last variant. The conditions that gave rise to this pandemic will persist. And I think we're going to see more challenges coming. So, when's this pandemic going to be over? Well, all pandemics end. It's just that you don't get to decide. So, the question that I usually get is, what's going to happen next? I don't know, but I can tell you, based on some reasonable assumptions, that there may be COVID, the SARS-CoV-2 virus may change to be able to be more infectious. It's already done that several times. And again, that's airborne infection. The SARS-CoV-2 virus will probably infect a wider range of organs. Right now, it is infecting a lot of different organs, but it's mainly a respiratory illness. I could potentially see it evolving to infect the gastrointestinal tract, the central nervous system, and those sorts of things. And will it become more pathogenic? We hope not, but we don't know. The jury's out on that. So I'm going to stop there and turn it over to David Younts for his comments. And thank you.
Dr. Tripoli, thank you so much for that. Do you mind continuing to flip through the slides as we as we proceed. Thank you very much, sir. Appreciate it. So I've been reflecting as Dr. Tripoli was speaking just on how much was just shared. Thinking back to February and March of 2020, when I had very little understanding of public health, how public health impacted schools, and some of the language and discussion that we've just been having was completely off my radar. When you think about what's gone on in schools in the past couple of years, the quote on this slide from my colleague Sarah is really important. Those of you who operate schools understand that all of our folks, including nurses, principals, teachers, school superintendents, have had their operations taken over by this experience. And the biggest challenge that we've seen is taking the focus away from learning, taking the focus away from being able to operate schools safely on a day-to-day basis, being able to attend to the social, emotional, and mental health needs of students. All of those things are critical, and we've had to pay attention to many more things than we have in the past. Candidly, not necessarily what many of us signed up for. If you don't mind clicking to the next slide, Dr. Tripoli. My experience and where I take that from is I've been a school superintendent for the past 8 years. I just joined the AM team a month ago, coming off the heels of 8 years as a superintendent in the state of Vermont. I was honored to serve as the president of the state association for 2 years, and actually had the most rewarding recognition of my career when my colleagues named me as the superintendent of the year in Vermont in 2021. So I understand schools because it's been my professional life, and I'm a part of the AM team to help lead our work and help support schools to make sure that programs that AM develops and delivers are meeting actual needs in schools and are executable and able to do good things to keep students learning and staff well taken care of and communities thriving. Next slide, please. In general terms, the type of support that AM provides for schools, it's addressed on this slide. We are able to provide support in all of the areas that have taken over school operations in recent years. So contact tracing, testing, prevention measures, communication, education efforts for students, staff, and families, all of those types of things. If you proceed to the next slide, Dr. Tripoli. An example of that is some work we've been doing in the San Bernardino County School District in California. We have a number of projects currently underway, and San Bernardino is one of our first large-scale projects where we have essentially provided full service COVID support. What that means is our programs have provided what we call K-12 liaisons who serve in schools alongside the existing school personnel and have managed everything from testing to contact tracing to communication with families, taking the burden off of the school personnel who have been tasked with that in many other places, including the district where I was a superintendent, where my principals and my nurses were every day under a deluge of COVID work that took their attention away from their normal day-to-day operations. This slide just shows you a little bit of the success and some of the tangible impacts of what we have seen thus far in San Bernardino. Just for context for you, there are about 85 school sites in that district. There are just shy of 50,000 students. So large scale, but you can just see how some of these numbers shake out. In particular, if you look at the screening and testing piece in terms of the number of tests completed, the number of tests during the week of January 10th, 6,000 tests completed, and 2,300 of those tests were positive cases. That was when the Omicron surge started blowing up for all of us in schools, and we came back from that holiday Christmas break not aware of what we were walking into. One of the real high points in the San Bernardino situation has been that there have been 0 school outbreaks, that students have been kept in school as much as possible, utilizing modified quarantine practices and just good testing procedures and test to stay procedures to make sure that we're able to keep students and staff in school. And if you look at the bottom of that slide, just the sheer quantity of communication, which again would normally overwhelm school district operations, we've been able to take that off their hands and handle those inbound and outbound calls and work with local health departments to make sure that students and staff are well cared for. As we look ahead, obviously Dr. Tripoli's information shared is significant, and we all look forward to when the COVID era is more of an endemic than a pandemic. We realize that we want to adjust our services to make sure that we are meeting the needs of schools where they are. So what we're looking at currently is we are designing programs that will be focused around mental health and wellness supports for schools. We know that in schools prior to the pandemic, lack of access to mental health services was challenging and creating a crisis of its own. And we know that the pandemic has exacerbated that even more than any of us could have imagined. When I describe to my former colleagues what my current role looks like and what AM is all about, I try to use language that focuses on filling the void between public health needs and local and state and federal government's ability to meet those needs. That's where AM fits in. And we've stepped in the COVID space to meet those needs in places like San Bernardino. And our goal is moving forward to continue to support infectious disease management, because it will continue to be an issue for us, as Dr. Tripoli has suggested, but also to make sure that the other health and wellness needs, especially in the mental health space, are services that we're ready to provide. If you wouldn't mind, the next slide, please. So in the event that anything you heard from Dr. Tripoli today, or anything you've heard from me just in the past couple of moments, if that triggers any thoughts or desire for conversation or interest in talking about possibilities, I really want to encourage you to reach out. The first step is to reach out to us, and we would set up a Google Meet or a Zoom call with you. You'd probably see Alex and myself as a part of that team, along with maybe a few other of our colleagues, but we'd love to just talk to you about what your needs might be and how we can best support that. And then from there, we would review everything that we got and develop a plan that we believe would meet the needs that you have indicated. And then we'd work with you to make sure that that plan was appropriate before we got anything started. And we'd continue to revise on an ongoing basis if we need to. I'll turn to my colleague, Alex, who can pick up from there, but I want to thank each of you for the time today. Thank you very much.
Great. Thank you so much, Dr. Tripoli and David. I appreciate it. I would like to open it up right now for some questions. I saw a couple come through in the chat. One was around vaping, and I know Dr. Tripoli had answered that question in the chat, but if Dr. Tripoli, you want to talk a little bit more openly about how COVID can be transmitted via cigarettes, vaping, and also we had a question around, can COVID transmission increase with nebulizer treatments done in the building?
Yeah, so first of all, some people say, oh, I smoke and it kills the COVID, so you're not going to get it. There's no evidence to show that that's the case. There is some evidence in a couple of studies to show that smoking increases your risk of COVID. I've seen, there are several studies that shows that air pollution increases your risk of COVID. Smoke from wildfires increase your risk of dying from COVID. So anything that affects lung function, like smoking and vaping, is probably a risk factor for getting COVID. And there's some evidence to show that, although there's some studies that don't show that. But the question is to whether is a smoker more likely to give somebody COVID? And I think the answer to that question is probably no. The next question about nebulizer treatments. So there was a study that was published in Respiratory Medicine back in 2020, and it's called Guidance on Nebulization During the COVID-19 Pandemic. It says there are no known infection-related hazards to an uninfected person and also to a patient with COVID-19 that preclude the use of a nebulizer. But it is fundamental that all patients, regardless of whether or not suffering from COVID, always follow some practical advice, which basically means, wearing a mask and taking the usual precautions. So I would say that, let's say that you have somebody who's getting a nebulizer treatment, and I think that's what this is aimed at. Does it increase the risk of COVID? No, but whenever you give somebody, not known to increase the risk of COVID, but whenever you give somebody a nebulizer treatment, you should always take respiratory precautions in any case. Were there any other questions? Those are great questions. Thank you.
And I'd invite you to come off of mute if you do have some questions for either David, myself, or Dr. Tripoli.
I put up the thank you slide there, but now I can't see the chat box anymore. So I'm going to stop sharing and go back to the chat box and share my video. You know, I know a lot of people look at all this and they say, well, this is so complicated, and you know, it's very daunting, and it's, you know, what next, you know, that kind of thing. And I know I've read a recent article where people who in your situation are dealing with parents who are very vocal on each end of the spectrum on this. And you know, that some of them are demanding, you know, that mask mandates be lifted or masks not be used, and are emphasizing the negative effect of masks. And you see the same sorts of discussions around vaccination and that sort of thing. And then a lot of people have become really skeptical of people like me, experts, because we said one thing, we send them in one direction, then we send them in a different direction, and they get confused. It's complicated. And I think, how do you sift through all that? Well, I always tell people, it's hard to put all this together unless you have an expert consultant. And you know, this sounds like a commercial for AMLLC, but there are others out there. And you really need to tailor what you do to your situation. Remember, your situation is going to involve the local prevalence of infection, the number of people that you have that are susceptible to bad outcomes, such as medical conditions, you know, immunosuppression, lung conditions, etc. The local society that you deal with. You know, are there a lot of old people? Are there a lot of sick people? The sort of political situation that you're in, whether, you know, you have mask mandates, no mask mandates, you know, whether your public health department makes a certain recommendation or not. So you have to balance all those factors. And so there is no one size fits all. But if you're looking for some very common things that could help, I would say that focus on what you can do. I've mentioned air quality, I've mentioned vaccination, I've mentioned expert advice, I've mentioned common sense. Let's say you don't have a mask mandate or you don't know what to do. It's still an option for people who feel that they're susceptible or someone in their family is susceptible to wear a mask. I realize that you don't want to make teachers the mask police, and that's a very hard thing to do. So, you know, there may be other things that you can do to make mask wearing more of a voluntary choice. You know, funny mask contests, you know, encouraging people to understand that there may be other people who could be harmed if you know, if there's social pressure on them not to wear a mask. So I think that there are some reasonable things that can be done. You know, I would say that, again, we deal with a certain level of uncertainty with all that is going on with this virus. It won't be the last one. We have a dense population of people that come into contact with animals in certain parts of the world, more than in the United States. That we have a large proportion of people who are older, immunocompromised, obese, and as you know, obesity has been an issue in the South and all of the United States. So those factors still exist, and they can lead to the emergence of another virus like this, or the continued changing of this virus to exploit new opportunities. So I think going back to the way it was is not going to happen. We're going to need to be smarter about air quality and about how diseases are transmitted in the future.
Great. Well, thank you, Dr. Tripoli, and I appreciate you sharing your expert advice. Are there any last questions? I don't want to wrap this up too early, but I do know we're coming up on time and we want to be respectful. All right, well, seeing none, just a quick closing remarks. Thank you so much for joining us this morning. We understand it's early. You guys have probably a million other things to be doing, especially as you continue in the school year. But we want to just one more time offer ourselves as a partner for this school year, for the next school year, as we transition to what comes next. As a company, we've done a really good job of bringing on experts to help us and guide our policies and our programs, like David joining us recently. And we hope to be a support system for you. If you have questions, you're welcome to reach out to myself, Randy, to Marisa. Again, the website is amllc.co. You can email solutions@amllc.co if you have direct questions. This recording will make available afterwards. So if you did have somebody that you wanted to see it, or we had some other folks that registered who were unable to join us this morning, we stand ready to help you, to partner, to, as Dr. Tripoli said, consult and give some advice if you need it in terms of where you could possibly go as you're planning out for the next school year. It's not a commitment to have a conversation with us. So I just want to extend the invitation. And with that, Randy, if you have any closing remarks, I'll hand it over to you. And I thank you each for your time this morning.
Thanks, Alex. Just real briefly, many of you may be questioning about funding for various programs. You're familiar with your ESSER funds. Some of you are tapped out on those, but there are other resources out there. Some of you may have money left or money on the table that you haven't considered what can be done. So I would encourage you, the team at AMLLC can help you with funding resources and opportunities for you to be creative with the money that you've got or money in your account, or if you've got programs that you would like to see funded, what are some opportunities for trying to get those programs funded? These are things that we need to be looking at as we head into the fall school system, and anything that we can do to help you in that arena, please let us know. And that's all I had. Thank you all for being here. We will be contacting you personally, sending you copies of this and some additional information. And again, if you have any questions, please feel free to ask me or Marisa directly, or any of the team members at AMLLC. Thank you so much for being here today.
Everyone.
Thank you.